Hello, everyone. I'm Sarah Downey, and welcome to the community edition of Five Questions. This is a series that we launched within our hospital, within the Michael Garron Hospital, to give staff the chance to hear the answers to questions from some of our experts about COVID-19. And it occurred to us that our community is probably also interested in the answers to some important questions from our experts. And so this is our first community-based edition of Five Questions. And today it's my privilege to welcome Dr. Jeff Powis, who is a medical director of infection prevention and control at Michael Garron Hospital, and really the subject matter expert in all things COVID. So welcome, Dr. Powis.
Thank you, Sarah.
So maybe we could start with, can you describe your role at Michael Garron?
Sure. So I'm an infectious diseases physician. So my medical specialty is infectious diseases, but I'm the medical director of our infection prevention and control team. And really the role of that team is to make sure that we keep our patients and our staff safe from COVID-19. And that involves many different things that we're doing at the hospital to ensure that there is no transmission of COVID to patient or patient to staff.
Great, thanks. And can you briefly describe some of the major pieces of work you've been leading within our organization so the community gets a sense of what it takes to keep us safe?
Yeah, no, it's been a never-ending job, I would say, starting around January the 15th when this first came onto my radar. And we've been doing an extensive amount of work about reorganizing the way we provide care, to put systems in place to reduce the risk to everyone, including our patients and staff. And that involves additional training, additional personal protective equipment, and a change in the way we do some things that may have been considered safe in the past, but in the new environment, we don't feel are safe to provide on an ongoing basis.
Perfect. Thanks. Now I have a series of questions that I think are of great interest to the public and our community. And first, let me say thank you so much to the community that lives around the Michael Garron Hospital. We have appreciated the banging of the pots and pans in the evening. The mask sewing campaign has been phenomenal. At last count, we had 17,000 masks that have been sewn and dropped off that we use on a daily basis. And the PPE drive is tremendously in being prepared. So we're happy to give this back to you, which is answers the questions. My first question is, Dr. Powis, should I get tested for COVID-19?
So the first thing I think is important for people to appreciate is what are the symptoms of COVID-19? And the virus and the infection present very much in the same way influenza or a cold would present. One of the challenges with this infection is the presentation can be variable and different in one group compared to another. Most commonly, the symptoms would include fever, sore throat, runny nose or stuffiness in the nose, cough, particularly people report a dry cough, so not producing any phlegm. Some people have gastrointestinal symptoms, and a lot of people are describing to me muscle aches and pains that you would normally get if you had influenza with fever. Now, in addition to the symptoms, one question people often ask me is, well, when should I actually go get tested? There's lots of increasing information about testing capacity in the province. At present, we don't have the capacity for you to do testing in the home. That might be something we have eventually, but we don't currently have that capacity in Ontario. And so we're asking people if they need testing or have the desire to be tested to be assessed in the Community Assessment Center. Now, testing, the same as all resources, is a limited resource. And so we've developed criteria about who we should direct that limited resource towards. And our focus in testing at this time is to test people who are at higher risk of complications, so those people who are older or with coexisting medical problems, healthcare workers who might be working at some of our community partner sites, and also individuals who are vulnerable and may live at some of those community sites, such as long-term care homes or retirement homes, or other areas such as shelters. And then the other question I commonly get when I talk to patients is, well, when do I need to go to the hospital? Not so much for testing, but when should I be worried if I do have these symptoms of COVID? Most people can self-care at home, but the things that I always worry about are day 5 to 14 of symptom onset. If people get problems with breathlessness and cough, those two things together, that's when you need some assistance with hospital care.
Thanks for that. Next question is, what's your advice for people living in apartment buildings? We know there's a lot in East Toronto, or in close quarters with many family members under one roof. How do we protect ourselves in those situations?
Yeah, so me and my team were calling all of the positive cases at MGH. And so I do get the opportunity to speak to my community and address some of these questions and concerns. And so what I've been teaching people first off is that the way COVID is being transmitted for the most part has nothing to do with inhaling droplets from someone else coughing or sneezing. It's actually touching a surface that's contaminated with those droplets from somebody coughing or sneezing, and then subsequently putting it up to your face or your eyes. And so what I try to teach everybody is every surface could potentially be contaminated, and that virus can be washed off your hands with soap and water, 20 seconds soap and water, or if you have alcohol-based hand rub, to use that. So you just need to remember every surface in a common space may potentially be contaminated. And again, it's the hand washing that's going to keep you safe. Always clean hands up to your face. Now, many people are asking me, well, how long does it stay on surfaces? It can be variable based on the type of surface, but up to 3 days. And again, that's what's promoting transmission in the community. So if you do touch an elevator button, for example, as you're in your building, just make sure that that hand now has touched something that other people have touched. And as a result of that, it needs to be cleaned before you come up to your face, eat something, rub your eye, or rub your nose. A lot of people are concerned about the virus being transmitted through the air. And what I want to really reassure people is that it's not being transmitted through the air in the community. In medical situations, we do specific maneuvers to people. There's a chance it can be transmitted through the air. But again, this is being transmitted through touch. And so it's really that hand hygiene, the cleaning of your hands, the considering of surfaces being contaminated that is paramount to keep yourself safe when you are outside of your own living space.
Thanks. So what should I do if someone in my house tests positive for COVID and they're living with me? How do I protect myself from my children or my parents from them?
Yeah, and to be honest, that's one of the other reasons why I'm calling everyone, or my team is calling everyone, is because everybody I speak to, if I can educate them about how to prevent transmission to someone else in their home, that's doing good for our public and doing good for that individual. And again, when I talk to people, that's often one of their biggest concerns. And I have noticed that many of our community, there are multi-generational families, so there are maybe older people in the home as well. And so generally what I'd recommend is that if an individual is sick, that they try to self-isolate as best as feasible. Sometimes that's a challenge if the space isn't large enough and there's a group of people living within a smaller space. Try to kind of separate yourself from the rest of your family as much as possible. And again, the rule of thumb is within 6 feet. So you should try to separate yourself within 6 feet. If you have a mask, you could wear the mask. If you have a paper mask, that's fine, but a cloth mask, it would be more than adequate. And if you don't have a cloth mask, just something over your face, like a scarf, to prevent any coughing or droplets from coughing to enter out into the environment. The next thing I would say is that those particularly vulnerable populations, particularly people who have immune system problems or coexisting medical problems or are older, they need to be especially separated. The other advice I give, and again, this is something that I think needs to be amplified, is that I usually assign someone in the home who's healthy and not sick to clean all those common touch surfaces twice a day with something that kills the virus. This virus isn't hard to kill. It's just the actual physical elbow grease required to take it off common touch surfaces. So envision yourself walking through your apartment, and anything you touch and any horizontal surface should be wiped down twice a day. If you don't have any Lysol wipes or antiviral wipes, you can use bleach and water, you can use vinegar and water, or even just soap and water will adequately remove the virus from those common touch surfaces. And again, I would recommend doing that twice a day. People have asked me about their pets, and at this time, we don't think COVID is being transmitted from pets to humans. And so I don't think that's a big concern. And I think people should focus more so on that physical distancing and cleaning the environment as I directed. I've talked about hands. Again, every surface is potentially contaminated. Never bring your hands to your face or your eyes without cleaning them before doing so.
Great. Wash your hands and clean a lot. That's what I've learned from you, Dr. And don't touch my face. Really learned that from you, Dr.
Hard to do, yeah.
Yeah. What should I expect if I need to bring my loved one to the hospital for care related to COVID-19? What's happening at the hospital?
Yeah, so the thing I want to reassure the community is that, our teams have worked tirelessly to make sure that we can continue to provide you the high quality care that you've come to expect from Michael Garron. There are, however, changes in the way you may see care delivered. Probably one of the things you'll notice is that we have put some restrictions on movement throughout the hospital, particularly in relation to visitors. Visitors are all coming in through the Coxwell entrance and are screened by individuals to ensure that they're not having symptoms. We are restricting the number of visitors that can come to see patients, and we're doing that for the safety of the patients themselves, the other patients, not the one being visited, but also the staff, to ensure that we reduce the probability of COVID-19 being brought into the healthcare institution, because we are privileged to care for so many people who are vulnerable. And again, the message I'd like to give to people is that, we're doing this because we want to keep your loved ones safe. And I know it's a challenging time and you want to be with people when they're sick. We're trying to supplement connections by using virtual means to stay connected as best we can. But I want everyone to appreciate we're doing this because we want to keep your loved ones healthy and safe. The other thing I would reiterate is that if you've been in contact with COVID, so let's say your loved one is in hospital with COVID, you yourself are a contact if you live in the same household, and we need to adhere to those self-isolation requirements that public health is enforcing to ensure that we don't then go and spread it in the community. So if you are feeling sick, please try and connect with your loved one through virtual means, and please don't come to the hospital if you yourself are suffering any symptoms of COVID-19.
Thanks. So finally, and it's a topic of great discussion lately, is when should I, as a member of the public, wear a mask? And what kind of mask should I wear?
Sure. So I'd echo your comments at the start of this, Sarah, is that this has been a really hard time for everyone in healthcare, and seeing our community respond the way it did and produce masks when we asked them to is what keeps me going. And the masks that I've asked you, the community, to produce have been cloth masks. And you'll notice that is now being recommended by most kind of North American governments, that the community should be masking whenever they're out in the community within 6 feet of each other. Now, ideally, I'd like to save the medical grade masks for the medical providers, and the masks for the community, in my mind, the cloth masks are adequate. There's a few things people need to know about the mask, and again, it's the same education I'm providing my own healthcare staff. But when you have a mask on, you put it on, and you should try not to futz with it that much once you put it on. Leave it on, and then take it off, reach behind your ears, pull it off that way. And then once it's off, then you need to clean it before you're wearing it over and over again. And again, laundering it in regular soap and water is safe and will kill the virus. Many people ask me about gloves. The great thing is that we're covered in this amazing thing called skin, which the virus can't penetrate. You essentially have the most amazing glove on your hand all the time, which is skin. And if you sanitize the hands, and again, I know you're going to get annoyed with me for saying this over and over again, but clean hands can't transmit virus. We need to remember that's the best way to keep ourselves safe in the community.
So thank you very much, Dr. Powis, for all that you're doing to keep our hospitals and our patients safe, and also our community safe by doing these kinds of public education sessions. We really appreciate it. And thank you to our amazing community for all that you're doing to support us through this difficult time. We plead with you to remember to practice physical distancing, diligent hand washing. You've heard Dr. Powis say why that's so important. Limit your time outdoors in public spaces to essential visits only, like trips to the grocery store and the pharmacy. We really hope that these kinds of public health measures will make it such that the burden of COVID-19 will not overwhelm our healthcare system, and we still have a number of weeks of this kind of prudence that's absolutely necessary to keep us all safe and minimize the impact that this virus can have. And with that, thank you everyone, stay safe, and keep washing your hands. Have a good day.